everyone. We are so excited to share some of the value adds we have for the System Healthcare. I'm Megan.
I'm Ryan Williams.
We are thrilled to be a resource for you and your teams. What we want to go through today is some of our best options that give you wonderful coverage and keep our prices in a really good spot. And as we go through these three plans, we want to make sure that everyone is clear how they are different. There are positives and limitations to each one, but we want to make sure that you're picking the correct one for you and your family specifically. We are licensed in all 50 states, and we really love that we can bring comprehensive medicine to small businesses and large businesses across the United States. One of the neat things is we have worked really hard to find relationships with different brokerages and groups and carriers that are going to be of value. And so we're going to run through this first deductible plan and tell you some of the options that come with LifeX and its major medical.
Now, this first plan is very similar to any insurance plan you've ever had. There are several conveniences of this particular program. Number one is you get to select the carrier or the provider network that your healthcare is bound to. So if you've ever had insurance, you've heard the term in-network and out-of-network. And with this particular product, we are able to empower you with the option of choosing one of three carrier networks. You can choose the PHCS National PPO Network of Providers. You can choose the Cigna PPO National Network of Providers, or you can choose the Anthem Cigna PPO Network. That allows you the ability to choose what network of providers you feel most comfortable with. Now, the cost associated with the plan, depending on which of those carrier networks that you select, is going to be different. The Anthem is more expensive than the Cigna. The Cigna is more expensive than the PHCS. So in price order. Now, in my honest opinion, there isn't probably a 5% difference between the PHCS selection and the Anthem selection. You're not picking a good versus bad. They're all good providers. All of them are going to provide you first-class healthcare and access to facilities and doctors that you want to see in your local area.
That's right. The other great thing about having a major medical plan like this is that you have low copays and the deductibles. So again, with whatever deductible you choose for your family, individual and family out of pocket, then that is the future risk. It also determines what you are going to pay monthly. So for example, if you pick a high deductible plan, like $7,000 as an individual, the pricing monthly will be less than if you choose the $5,000 or even a $2,500 deductible. So again, the pricing will be determined by which deductible you choose. Now, the neat thing about that, though, is all of them have amazing copays. So $25 for your office visits with your primary care. You've got urgent care and specialists, $40 and $60. What's nice is that's all you pay. So again, the nice thing about major medical plans is everything's included in these nice copays, and then you only then pay for those deductibles when something major happens and or the medicines.
Now, these plans also include, of course, telemedicine, which is super convenient. And they also have a very comprehensive prescription formulary or prescription plan included. That means many of the medications you're currently taking or you might need to take in the future are going to be covered under a series of tiers, whether it's generic or preferred or non-preferred. There's a series and a list available to allow you to know what set dollar amount you're going to pay for a particular medication that you might need. Now, it is important to note in these plans, your initial prescription, if you have no health issues and then you run into a situation where you need medication, especially for maintenance, for ongoing purposes, the initial prescription will be filled at your local pharmacy, but the ongoing will be done by mail order. That's all part of this process. So again, if you currently are coming into the program with maintenance medications, of course they can get one filled for 30 days to cover you, but the other prescriptions are going to come via mail order pharmacy. And the reason being is it's less expensive. picking medications up at your local pharmacy is simply more expensive. So the way the carriers are able to reduce the overall cost to the total group and make this such a comprehensive program for everybody and long term is because we do mail order medications for long-term maintenance.
We love this. This is a great option for those of us who might have some continual things going. With every plan, there'll be some underwriting questions, health questions, but it's important to know that this is unlimited major medical, and we're excited for you to be able to have this resource and these pricing.
You're going to be provided a document or flyer for you to review if this is a particular product you feel best situated for your own family and situation. Please read through the document, understand what the deductibles are, what your copays are, and what all is included in the explanation of benefits.
Thank you.